IDPT, we're doing pelvic strengthening level 4. Let's jump into it. First one is pelvic hip drop off the step. So both legs are straight. My left leg is fully on the step, and I'm dropping that right foot below the level of the step and using my glutes to pull it up above the level of the step. This one's really working that glute med, and you just want to make sure keeping both legs straight for this exercise, as well as making sure your standing leg is fully on the step to give you that stability. Good, a couple more here. Next, we're doing a forward step up. This is a little different than maybe your traditional step up with both legs getting onto the platform. It's more of a single leg step up, so getting that right leg fully on the step, using the power of your glute med and max, hamstring, and quadriceps to push yourself up into that single leg standing position. We're doing a set of 10 each side. Switching legs now. Same exercise using the strength of that left leg, getting into that single leg step up position. Make sure you're using your breath here too to help you go through the motion. Good, a few more. Next, we have the lateral step up. So again, this is more of that single leg lateral step up, getting one leg fully up and the other leg staying off the step. This one again is working your glute med, glute max, hamstrings, and quadricep of that moving leg. So in this leg, that left leg. Using your breath here to help you go through the exercises. And again, for all these step up exercises, just make sure you're getting that full foot, that is stability, onto the step for your balance. Don't want to have half the foot on the step for this. Good, a couple more using the right leg this time, really helping yourself with those glutes, quad, and hamstrings to push yourself up and gain that stability in this lateral step up. Almost there. All right, we're switching to a unilateral wall squat. So use your wall or a pillar like I'm doing here. Get your knee and hip and ankle to about that 90-degree angle, and then extend that opposite leg. So we're doing 2 sets of 15 seconds on each side for this. Make sure you're breathing throughout this exercise. And I like to step out, give your legs a little rest and reset between each of the 15-second rounds. Get yourself reset and then extend one leg out. Really making sure you're breathing throughout these exercises. Okay, you got one more round each side for this exercise. Get yourself set to that knee, hip, ankle, 90-degree angle, and then extend that leg out. Good, and you can flex the toes here, toes pointing towards your nose, or point it extended outward. Depends on your preference. Either one is fine for this exercise. Last one of these unilateral wall squats. Got 15 more seconds here. Good, keep breathing. Really burning up those glute max med with this one as well. All right, next we have a side plank with hip abduction. So getting onto your forearm with the legs extended straight. We're lifting that top leg up into this abduction. I would use your breath exhaling as you're lifting that top leg up to give you some extra support. We're doing 10 each side here. Really working again those glute med and glute max. Also getting a little bit more of your back extensors with this one, as well as your core. Switching to the other side here. Get your forearm set up, legs nice and straight, coming into that side plank. Make sure you feel stable there before you add that leg lift. You got 10 reps here. Keep using that breath, exhaling as you lift the leg up. Great job. We got a couple more. You can grab some water if you need to here. I'm just getting the step out of the way so we have a little more space. All right, we got forward lunges next. So you're getting glute max and glute med, as well as your quad in this one again. So really hitting those glutes today, using your breath with this one as well. Like the exhale when you're coming back 2 feet together, inhale when you're stepping that leg forward. Got 10 reps each side. All right, we're switching to the other side. Make sure you get that knee in line with your ankle when you're doing that forward step in this forward lunge, and really giving yourself a nice push off when you're coming back to 2 feet together with that front leg. Keep using your breath. Just a few more here. All right, next we have a transverse lunge. So instead of the traditional side lunge, you're stepping back in about 135 degrees to the side you are stepping. So going to my right side, I'm stepping back about 135 degrees with that twisting turn. Again, keeping knee over ankle in this one. You're going to get a little bit more translation depending of that knee over ankle, depending on how far you step with that right leg. So just adjusting your step as you go a little bit is totally fine. Sometimes it takes a rep or two to really find your bearing with this one. We're switching sides. For these transverse lunges, sometimes you have to adjust that foot a little bit when you're doing that 135 degree step, so that you're making sure the leg that is staying still is nice and straight. So just adjusting as you go if you need to. So you're getting that long enough step with that moving leg so your back leg stays straight. Keep using your breath here, using that little exhale as you're coming back to 2 feet together. And again, getting that glute max and glute med here today. Next, we have our two-handed kettlebell swing. So set up for this, getting feet about hip width apart. You're going to extend arms straight with that kettlebell, a little bend in the knees, and most of your movement here should be coming from that hip hinge, so that butt going back like it's closing the door behind you. And these kettlebell swings should be nice and quick motions. Use your breath, exhaling as you're swinging that kettlebell forward, coming back into standing. You got one more round of these. Again, set up feet about hip width apart, extend the arms straight with the kettlebell, a little bend in the knees, and then butt going back like you're closing the door behind you. So getting mainly that hip hinge, using the legs, pushing into extension to help get that kettlebell up. Really getting a lot of that glute max and glute med strengthening here as well. All right, you got one more exercise, 10 reps each side. We're doing a single leg deadlift with the opposite leg hip extension. So what you want to do is get yourself set up so that one foot is against the wall or a block like I'm doing here, nice and stable. And then again, using that hip hinge, you're coming down with the weight, keeping the knee a little bit bent, hips mainly hinging to get you this forward motion. And weight is sliding down the calf, the front of the shin as you're going. Ten reps on the other leg, you got this. So get yourself set up. You might need to kind of readjust that standing foot as I did here to get yourself nice and stable before you get started. Really pushing into that foot against the block or the wall to give you stability, and hinging at the hips to get this forward motion. Weight is sliding down that front of the shin as you're coming down. Good, you're almost there. And that's it. Great work, everyone.